Treatment for breast cancer is scary, and I think that the role of the medical oncology team is really to demystify it and carefully explain what will be happening and what can be done to ameliorate certain side effects. It's extremely important for the patient and the medical oncology team to have a very open dialogue where they feel that they can reach us 24/7 to address any kind of unexpected side effects or concerns. I also think it's important to be in a place where psychological support can be offered, such as psychiatrists, psychologists, social workers who can help with plugging patients into support groups and also just providing supportive therapy. And I think it's really important to inform patients, for example, that some chemotherapy drugs can cause damage to small nerves in the fingers and toes most commonly. That's called peripheral neuropathy and can result in numbness and tingling of the fingers and toes. Acupuncture has been shown to be helpful for the treatment of neuropathy. In addition, a lot of our treatments for breast cancer involve menopausal symptoms because we're frequently in a situation where we're putting a young person into premature menopause and having to manage the side effects of menopause. In addition, many of the anti-estrogen medications have menopausal symptoms as side effects. So thankfully, there's new drugs that have been studied that have been shown to be effective to minimize hot flashes or vaginal dryness. I always specifically ask my patients about a symptom such as vaginal dryness. It's not something that someone might offer on their own, and for them to know that it's a normal side effect of the drug they're on and there are things that can be offered that might help is really important. We know that patients who exercise regularly have a better prognosis in terms of reducing the risk of the breast cancer coming back, as well as exercise really helps ameliorate some of the side effects of chemotherapy. So as much as people feel up to it, I recommend at least 30 minutes of walking 5 days a week is a good goal. And I find that that really helps with the fatigue and other symptoms associated with treatment. The medical oncologist should be very forthright about what the various treatment options are, detailed information about possible side effects and how to manage those side effects. And if the patient is not receiving that sort of information, then that would be a sign that advocating for oneself and finding a situation where those things are being done is important.